Okay, this is the manual muscle test for the trapezius, the lower fibers of the trapezius. So the lower fibers of the trapezius can be found roughly in line with the scapula, which is right about here, and that goes all across in this fan to the spine. So it's this big fan of muscle right here, the lower part of the trapezius. The upper part of the trapezius, as you know, is up here. So what you're going to do is you're going to bring the arm into about 140 degrees of shoulder abduction, right? So one of the things that you want to do is, if you can see it, if you look very closely, and you may not be able to see it with the video, but you can kind of see the line of fibers kind of going in this diagonal line. And a lot of men who have hair on their back, you'll see like the hair will kind of go in that line. So you want to be kind of like lined up with that, right? But if you can get close, on some people, especially women, you know, you'll see the line of the fibers kind of like going this way in the lower trapezius. So, right, so this is 90, right? This is 180, this is about 140 degrees. And then you want to bring the arm so the thumb or large intestine 5 is facing straight up. And so what you're going to be doing is you're going to be holding the wrist here, and eventually you're going to be using pressure right about here around large intestine 6, maybe like lung 7 area. And then you're going to stabilize the other scapula with your opposite hand, okay? Because again, we want to help the patient feel stable as well as prevent them from recruiting other muscles. And so what you're going to have them do is you're going to be, and I'll explain it and then I'll do it, is we're going to be pressing down, and then they're going to resist. So they're going to be holding their arm up while I'm gently pressing down, gently. And then what I'm looking for is I'm looking to see, does the scapula kind of pop up significantly off of the back? And you'll see it. And some people have very weak lower trapezius muscles. You'll see the scapula come up like about an inch. Or you might see the scapula pull this way, abduct, right? Abduction. So adduction is towards the body, abduction is away. So you may see the scapula pull away. All right, so I'm going to press down, you resist, and resist, and resist. Okay, and then relax. Okay, and then one more time, and resist, and resist, and resist. So you can see he wants to be strong, so he's even like recruiting these muscles over the opposite shoulder. But he is strong. The lower trapezius muscles are in very good shape. There was no significant raising of the scapula, and there was no significant abduction of the scapula outwards.